wanted to send a very strong message to the Health Estimates Committee that it's time for some answers about this payroll debacle. When will it be fixed? And when will our members get all of their lawful entitlements? So that's why we're here today.
So when they rolled out this new pay, of course, we thought, well, this will be better than Lattice, won't it? Because Lattice was pretty bad. And of course, you know, this one turned out to be just far worse than Lattice ever was. And of course we know that people are still owed money under Lattice as well. Some have been paid, they tell us, or they say the Lattice payments have all been made now, but we certainly don't have the confidence that that's the case because of what our members are telling us. Well, we then got the Auditor General's report by the end of June. I won't go into all the history of it. You know it well, and we've recorded it for you. We have been to endless meetings. Well, we didn't need the Auditor General's report to tell us that this was a major disaster, but it certainly confirmed that view that it was a major disaster. But what the Auditor General's report looked at, of course, was the governance failures, and they were significant, but also the technical flaws in the system. Now, if they tested that system properly, if they'd done the parallel pay runs, all of those things that the experts tell us now should have been done, then they would have known, of course, that there would have been problems. Queensland Health pays 78,000 people in their payroll, 78,000 people. And they have a workforce that, you know, significantly works shift work 24/7 and lots of overtime and lots of changes because you prop up that system. You prop up that system every day. You change your shifts at the drop of a hat because somebody needs to fill those shifts. So every day of the week, 365 days of the year, you are doing that so that you can provide health care to Queenslanders. And what we want to know is this system fixable? So is SAP and No Brain fixable? No. And if it's not, then what's plan B? What else are they going to do? And how long is that going to take? As I said before, one of the fundamental rights of workers is to be paid what they're owed and on time. But just remember, it's your pay, it's your right, it's not a privilege.
With that said, I have two resolutions to put to you which were distributed earlier, so if you could read them along with me. Motion 1 is, members of health unions at today's rally express their dismay and anger at the failed implementation of Queensland Health's new payroll and rostering system. We call on the Queensland Government to demonstrate responsibility for Queensland Health's payroll failure and for fixing it now. We specifically call upon the Queensland Government to ensure that appropriate corrective arrangements remain in place across Queensland Health to correct pay errors and ensure that all staff immediately receive their lawful entitlement to their full wages on a fortnightly basis. Resolution 2 is that members of health unions at today's rally move that the relevant state government ministers and Queensland Health officials immediately come clean with Queensland Health employees and the wider Queensland community about the genuine, real performance status of the new payroll.
Of this disaster, our number one priority has been to make sure that our members get their lawful entitlements immediately. That has been our number one priority, to fix up the problems that this new system has caused and to actually assist and support those members who have been so distressed by that. Our second priority has been to actually to stabilise and improve the system, to work on doing that. We're a long way off achieving that, but we'll continue with that really important work. Please rest assured this wasn't a disaster of our making or of making of any of the other health unions, but we're stuck there for the duration to fix the problem. We have to remain focused on fixing the problem, and we will be there, boots and all, doing that for you. So thank you very much for your attendance today. You might just want to make a little bit more noise before we head off back to the City Gate. So if you can,